Coronavirus infections and deaths are ripping through the Navajo Nation, located in 3 different states. With an already vulnerable population, coordinating care and information is not easy. As the NewsHour's Stephanie Sy reports, the community has taken on the challenge of caring for their own people.
In Navajo country, COVID-19 found its grip at a religious revival event in early March in the upper western reaches of the reservation.
We have clan families that come all over the Navajo Nation to participate in these events. And boy, it just took off like wildfire after that.
After the so-called super spreader event in Chilchanbito, President Jonathan Nez put increasingly strict orders for social distancing in place, including weekend curfews.
I haven't even personally myself been able to hug my grandma, stand at the door, drop off all the stuff on the porch, and I just wave at her. That's it.
At least 52 people who live on Navajo Nation have died from COVID-19, including one of 18-year-old welder Trevor Tachitney's relatives.
One person on the other side of my family has got it and has passed. I'm very concerned about it because I have family members that are young and are susceptible to it, and it's scaring my mother and my father every time we go out.
Getting the message out about social distancing on the reservation was initially difficult. Nez broadcasts daily updates on Facebook, but many households lack quality internet access. It's also not practical for many on the reservation to follow stay-at-home orders. Sprawling across 3 states with a population of more than 173,000, wide swaths of the Navajo Nation are energy, food, and healthcare deserts, and actual desert with limited water.
We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water.
You know, we're a vulnerable population.
1 in 5 Native Americans has diabetes, and there's a high prevalence of obesity, both underlying conditions that can make COVID-19 particularly dangerous. Even the younger people on Navajo Nation have worse health outcomes.
We are seeing some patients that are not over 60 that are coming in with severe COVID illness and they almost all have comorbid conditions.
Dr. Diana Hu has been working at the Tuba City Regional Healthcare Center for more than 30 years. The pediatric ward where she normally works has been turned into a respiratory clinic, as has much of the hospital since COVID-19 struck.
It was actually almost more like a tsunami when this first started in the middle of March, where we had 9 or 10 people getting sick in a day that had to be flown out for tertiary care. We get maybe 1 or 2 a day, and it's real obvious when they're sick, unfortunately.
Many Native American hospitals are not equipped for multiple severe ventilator cases. For now, patients are airlifted to facilities in Phoenix and Flagstaff. But Dr. Hu and her colleagues are bracing for an overwhelming surge.
If you know any nurses that want to come work up here, we'd love to have them.
This week, the University of California, San Francisco sent 14 nurses and 7 physicians to Navajo Nation to help. The most pressing shortage has been personnel. And this thing has not peaked on the Navajo Nation.
We're not sure. If you look at our statistics, which are per capita, it's outrageous. The biggest issue I think that we have with the federal government structure, the coordination is pitting tiny places like us against states, against other hospitals, and the coordination is being left up to the states, which is very difficult when you have something like the Navajo Nation.
Navajo Nation has one of the highest rates in the country of COVID-19 on a per capita basis, behind only New York and New Jersey. In Arizona, about 20% of deaths from COVID-19 have been Native Americans, when they make up only 5% of the state's population. The CARES Act granted $8 billion to stabilize tribal communities, but the more than 500 sovereign tribes had collectively asked for closer to $20 billion. The Navajo have been the worst affected, but other tribes are facing the same threat. In New Mexico, multiple Native Pueblo communities are seeing infection rates of coronavirus higher than big cities. And the Red Lake community in Minnesota declared medical martial law several weeks ago, containing their spread to 1 person. Back on Navajo lands, President Nez described the frustrating process of accessing federal funds.
It's taken too long. Here in the Indian country, it seems to me, we're always at the bottom of the list when it comes to federal resources.
The health disparities laid bare by COVID-19 have reverberated across the Navajo Nation since the time of European colonization. In 2009, the H1N1 flu was 4 times as deadly in Native peoples as it was in the general population. During the Spanish flu pandemic of 1918, a similar story.
We can't change history. We should just hopefully learn from it.
In recent days, vital resources have been delivered. Rapid test kits that President Nez says can give results in less than an hour. The National Guard has brought in supplies, initially from its own stockpile of masks and other protective gear. And people are stepping up to fill the needs of their neighbors. Navajo sewing masks for frontline workers.
I delivered some to Kayenta Health Center, and they've been wanting more masks.
Navajo delivering supplies to the most isolated residents.
We definitely see the need to make food and supplies like toilet paper and soap available during this time.
We came across an elder who lives alone, and he has no food. So we packed extra so that we're able to give in case we run into this type of situation.
And Navajo coming together in shared struggle.
We're encouraging our elders to share their stories, the stories of our culture, our tradition, and our language, so that our young people don't remember this time as a scary moment. This is, in a way, what we've been praying for, to reunite families, to reunite couples, to hand down our language, our culture, tradition to the next generation.
It may be an optimistic way of looking at a pandemic, but it's the stories the Navajo tell that have helped them endure. For the PBS NewsHour, I'm Stephanie Tsai in Phoenix.